Well, good afternoon. Tinnitus is such a huge topic, and this is a condition that affects so many people, millions of people, for which there is no cure. So I am absolutely thrilled to have my guest here today. Dr. Ed Farrar is, listen, he'll tell you his story, but he's a medical doctor by training. He does suffer from tinnitus, and he and his colleague have come up with what I think is a very interesting and immensely valuable, I won't say it's not a cure, Ed, but it's a solution to management and living with tinnitus. So you're very welcome to today's Room Junkie Show.
Thank you, Anne. Thank you so much for having me. I was really excited when you got in touch. So yeah, I suppose I'll just give a bit of background about myself. So
do please, yeah.
Thank you for the introduction. It's very kind. So I'm Ed. I'm a medical doctor by background. In my last year of medical school, about 5-6 years ago, I joined the Air Force, Royal Air Force. And the original plan for me was to train to be a plastic surgeon. But during my time in the Air Force, I developed a condition called tinnitus, which I'm sure many of your viewers will be aware of or know someone with. But for those that don't, it's a condition commonly experienced as ringing in the ears, rushing, roaring, or an unpleasant noise in the ear that doesn't go away.
Constantly, yeah.
And yeah, constantly, yeah. So I had this condition very mildly. It didn't cause me too many problems, thankfully. But it was during my time in the military that I realised that I started speaking to people, men and women, that had been diagnosed with tinnitus that had been caused by or relation to hearing loss from noise exposure. So I'm sure you can imagine in the military, large number of people exposed to explosions, weapons firing, ships' engines, jet aircraft, that sort of thing. And in speaking to these people, I realized that it's a condition that has a huge impact on quality of life. And it was, sort of speaking to these people, I thought, okay, well, there's a big impact on quality of life. It's a condition that's affecting so many people. There must be help out there. There must be there must be a cure. There must be some sort of treatment available. And it turns out there isn't. So I sort of did some more research. There is effective treatment available in the form of something called cognitive behavioral therapy, which is a type of psychological talking therapy traditionally used in things like chronic pain, anxiety, and depression. But to access this type of treatment on the NHS, you'd probably be waiting 5-6 months, perhaps even a year, to see a therapist to access this type of treatment. So you've got this condition that makes people's lives miserable, has a huge impact on quality of life, and people are waiting for months, for years, perhaps, for treatment. If you don't live in the UK, or you want to, or you live in the UK, sort of upwards £100 to see a therapist privately. So which is prohibitively expensive for most people. So I sort of had this realization: there's a big problem here, a condition that has a big impact on people's lives. And for this condition, tinnitus, no easy way exists to access effective and cost-effective treatment. So I sort of got together with one of my colleagues, actually lifelong friends as well. We've known each other from medical school. George is a doctor in the Navy, and we decided to build a solution to tinnitus. And it was this point I was sort of becoming a bit disillusioned with my career with my career as a doctor, I suppose. I was having some doubts, so I thought, okay, well, I've got an opportunity here to use the skills I've learned in the military and as a doctor, and apply these to a startup, I suppose, and build a digital solution for tinnitus. This was about a year ago now, and we launched. We spent a good few months building the product, which turned out to be an app. We launched in December, and yeah, we've had a great response from users and professionals alike. So I suppose that's my story, and that's where we are now.
That's a wonderful story. But you know something, Ed, I think, and you know that I trained as a nurse, you're a doctor, we are living in a digital health revolution. I know a physio who is developing an app to help people with Parkinson's. And I mean, we all have our mobile phones, so it makes sense. It's genius to think that this could provide us with a comfort, because you're talking about all these noise-induced tinnitus. You know, think about musicians, DJs. I work in I'm an interior designer. I'm constantly on a building site. I'm probably the only one who ever wears the earmuff. So all these young guys have got Kango hammers and all this noise, and it's having a phenomenal impact. I mean, tinnitus isn't just living with the ringing of the ears. It can cause anxiety. It can cause depression. It can cause so many things.
Tinnitus is, and this is something I didn't realize before I started speaking to people with tinnitus or with severe tinnitus. You know, I have tinnitus myself. Thankfully, it stops me from sleeping from time to time. But for people with severe tinnitus, it has a considerable impact on their quality of life. So as you mentioned, if you just imagine a persistent, unpleasant noise in your ear that just doesn't go away, and you're stuck with it for, you know, not just for the rest of the week, not just for the rest of the year, but for the rest of your life. And, you know, these people think, oh my God, I'm stuck with this, like this horrendous noise, and there's nothing that I can do to get rid of it. So, you know, as you mentioned, it has a considerable impact on mental health because for obvious reasons, but it stops them from sleeping, it stops people from concentrating. And yeah, tinnitus can be so severe that it can drive people to suicide, as we've seen numerous cases which is terrible. And for something that affects 1 in 8 people, that kind of, you know, frustrated me when I found out about this. I was like, you've got this condition that is so impactful, but the help that is available is just not there, and people don't realise that the impact it's having.
I don't even think that there's an awareness. When I trained as a nurse, we were taught very little about tinnitus. I don't think it gets the attention it deserves, to be perfectly honest.
And you're so right there. I mean, so I don't think I learned anything about tinnitus at medical school. So I did 5 years trained as a doctor, and we spent weeks learning about you know, every other sort of pathological condition that commonly affects people. And you know, if you think about other common conditions that affect people, we learn the exact mechanism and the exact sort of pathology behind these conditions. But when it came to, I suppose hearing loss could be grouped into this category as well, because we didn't know much about hearing loss, which is also a very, very, very common condition that has a big impact. It
causes such isolation. Social isolation has a mental impact as well, because you're not part of a conversation. And if you have tinnitus, you're probably, if there's external noise, or if you're in a bar or a pub or something, I wish, but that noise in the background probably has an effect on your tinnitus as well, or does it?
So actually, people find slightly noisier environments. People with tinnitus find noisier environments somewhat relieving, because when they can hear the sound of, say, for example, you know, people talking in the background, or some music, or even just something like having the window open and hearing cars drive past, that sound distracts them from the sound of the tinnitus. So one of the sort of the main therapies that people use in tinnitus is something called sound therapy, which is the playing of a sound to distract from the noise or to mask the sound of their tinnitus. And that's one of the things that one of the sort of the treatments that we use in the app is something called sound therapy. I suppose I've gone onto the app, so I'll just quickly tell you how the app works. So,
do, please.
So I mentioned there is no easy way to access the science-based, cost-effective therapy. So what we've done is we've brought together all the evidence-based, the therapies that have been shown to be effective in reducing the impact of tinnitus, and we put them into a digital therapeutic or a mobile app. So it's centered around cognitive behavioral therapy, which is the treatment I mentioned earlier. But it also includes things like targeted mindfulness, mindfulness therapy, sound therapy that I've already mentioned, and some things like relaxation therapy, and some physical jaw and neck exercises as well. So the way CBT works, the way CBT helps in tinnitus, is it changes the way the brain reacts to the sound. So I'm sure people have heard of this thing called neuroplasticity, which is essentially rewiring the brain, rewiring the way the brain approaches things. And when you first hear the sound of tinnitus, it activates your stress response, and that's a very unpleasant. It's a very sort of unpleasant feeling for people, because they hear this unpleasant sound, their stress response gets activated, and then that stress response then makes the sound louder, and it's like a vicious cycle. So what CBT does is it aims to interrupt that response and interrupt that negative cycle, a negative spiral, and get you to the point of what we call habituation. So habituation is the point where you can hear the tinnitus, but you don't notice it like you did before. And when you do hear it, it doesn't distress you. And an example of that would be, a real world example of that for someone that doesn't have tinnitus would be, if you imagine going on a long car journey, 2, 3 hours, 5 hours, whatever. And at the start of the journey, you're very aware of sort of the sound of the wind going past the car and the tires on the road. And it's, it's quite an unpleasant sound. But after sort of 20 minutes or so, you just don't notice the sound anymore. It doesn't bother you. And that's what happens with tinnitus. And that's what CBT does. It gets you to that point faster. That's
interesting. It's a bit like somebody living opposite a train station who don't hear the trains, and you come to visit and you can't sleep at all. It's amazing. A few people have come in here, and I'm fascinated about something. I actually didn't know that tinnitus is sometimes worse at night. So I know Shirley Kennefic is here. She does suffer from it. Trish Collins. Hi, Anna. So interested in this topic. I have tinnitus for years, mainly at night. I mean, my God, if your sleep is impacted as well, that adds another layer to everything, doesn't it?
Mm-hmm.
Lots of people.
I'm first off, thank you for the comment. I'm very sorry to hear you've had tinnitus. I know it can be difficult at night, because my tinnitus is worse at night as well. And one of the things we want to be able to do with this app is provide a way for people to relax, people to sleep better at night. So we have a certain module in the app that is specifically written to help you get to sleep. So it incorporates some of this therapy, this CBT. But we've also got some sort of sleep stories that you can listen to, and we've used literature and some modern stories as well. And you can select a sound to play. We've got 100 sounds in the app that you can go through and choose. You can select a sound, and you can use these stories to help you get to sleep. The idea being that you relax the body and you relax your mind, I suppose. I'm using these techniques that we teach you. You relax your mind in sort of a shorter space of time as possible. So you're relaxed and you're not thinking about your tinnitus before you go to sleep, when you're going to sleep. And it's something that's really, like, sleep aspect is so important for us to get right. We're spending a lot of time working on some therapeutic techniques for sleep and getting some feedback. But yeah, I'd love to, if you've got the people watching, I'd love to see what they think to the sleep therapy. So please give it a try and let us know what you think.
So tell me, say I want to, or my husband is certainly very interested. How do they access it, or how do they get in touch, or what do they do, Ed? What's the process?
Yeah, sure. So it's available on the App Store and the Google Play, the Apple App Store and the Google Play Store. So if you just search Otto Tinnitus, Otto is with 1 T, by the way. It should be the first app that comes up. It's free to download. It's free to try. Really? So you get sort of 2 or 3 therapy sessions for free, and you get sort of 5 or 6 of the exercises for free as well. And then if you want to, if you think this is going to be something that's useful for you, you can sign up to a free trial. It's either 3 days or 7 days, depending on whether you sign up monthly or year, or for a month to pay monthly or pay yearly. You can access all the content completely free without paying anything. So you've got a week maximum to try everything. And if it's something that you don't think is going to help you, then there's no need to pay. So, but I'm really confident it will help you. We've had really, really good feedback and reviews. If you just look at the reviews on the App Store, we've had some really positive feedback so far.
Yes. And you've helped a lot of people so far. Shirley's saying, my tinnitus only bothers me at night, can keep me awake all night sometimes. Oh, good Lord.
Oh, I'm sorry to hear that. That sounds very distressing. And we speak to a lot of people. I've spoken to a lot of people that have a similar experience. When they wake up in the night and their tinnitus is very loud, it stops them from getting to sleep in the first place. I suppose my advice would be finding a sound, or finding what we call a mask. So finding something that is a sound that works for you, and that usually comes with experimentation. So it could just be something as simple as, was it Shirley?
Shirley, yes.
Yeah, so Shirley, I'm sure you've tried lots of different things, but some things can be as simple as leaving the window open at night. There are pillows available online with speakers in them that you can play certain sounds to. I'm sure you've heard of an Amazon Alexa as well. So if you get an Alexa, you can play sounds through the Alexa. You can set a timer on there. Don't play the sounds too loudly. Find a sound that works for you and play it at the minimum volume you need to overcome the sound of the tinnitus. And try not to play it all night as well. Set it on a timer so it stops after you've gone to sleep, because then the sound might wake you up. And then I mentioned, of course, the app as well. We have some sections in there specifically targeted to help people with sleep, and we're continually adding more content, more therapy sessions to help you get to sleep and to help you get a good night's sleep with tinnitus. So I really hope that's something we'll be able to help with.
That sounds amazing. Deirdre Friel, hi Anne and Ed, delighted to hear this topic being covered. So am I. It can be a very debilitating condition but can be managed. And I think that people need to be positive and optimistic that, okay, there isn't a cure, but there are ways of managing this.
Completely, yeah. I completely understand the sort of the I suppose the desperation that you have when you're first diagnosed with this, because you have this really, really unpleasant sensation. It's a sensation, it's not just a hearing, it's like a sensation inside your head. And I can understand the sort of the distress that people have. You think, oh my God, like this is with me for the rest of my life, and there's nothing I can do about it. And you see the doctor. A very frustrating experience with people with tinnitus is seeing the doctor, by the way, because GPs don't know how to manage it. The evidence suggests that the GPs will manage it in numerous different ways, which I'm sure many people watching will have experienced. So that's a frustrating experience in itself. But when the GP says, or if your doctor says to you, or if your ENT surgeon says to you, I'm afraid there's nothing you can do, that is, and your viewer was, the person watching was very right, that's just not correct. There is ways to manage it. And once you've found the ways that work for you, CBT is very effective in tinnitus. We know that from the research. There have been numerous studies published. And once you've sort of found that sort of that technique, found that sort of way of doing things that work for you, a life without intrusion from tinnitus is absolutely achievable for anyone. Being positive I completely accept being positive is very difficult when you're first diagnosed, but once you sort of found a thing that works for you, it can have a big impact. So yeah, it's a really relevant comment.
That's amazing. Actually, one thing that's concerning me, because I know we're learning now that people post COVID-19 are developing tinnitus. Can you tell us anything about that? So we know from numerous studies that have been published recently that tinnitus is a long-standing side effect of, well, I wouldn't say necessarily side effects, the wrong word, sorry. It's a long-standing effect of COVID-19. I may be wrong here, but I think it's something like 6% of anyone that's had COVID-19 will be left with chronic tinnitus. 6%?
I think it's, I need to double check that, but I think it's around.
That might
6%.
make sense. I actually was with a client on Saturday. He's a doctor, and he said that here they're finding that 10% of people are suffering from long COVID symptoms. That's phenomenal. It's
terrible, and it's the long COVID in itself is very unpleasant. I know lots of people. I've spoken to patients of mine that have had long COVID, and it's left them completely debilitated. If you add tinnitus into that as well, they're left with, so just for reference, for people that don't know what the symptoms of long COVID are, long COVID is sort of a long-term effect, a long-term sort of legacy of when you have COVID. Around 10% of people will have long COVID, and it's commonly characterized as sort of lethargy, weakness, sort of general body pains, and there's a number of other symptoms that can be associated with it. And one of those symptoms is tinnitus. So we've seen, actually the research has suggested there's been a big influx of new diagnoses of tinnitus this year due to COVID. So the British Tinnitus Association has seen a huge number of extra calls to their helpline of people that have just been diagnosed with tinnitus and are looking for help. This is particularly relevant because sort of the whole reason that Otto and the whole reason this app came about, and the whole reason that this business came about, was because there is already a disconnect between the number of people with tinnitus and the number of audiologists, the number of therapists that are able to deliver therapy. And because there's this disconnect, as I mentioned, there's no easy way to access cost-effective evidence-based treatment. And now the tables have been turned even more. You've got more people with tinnitus, and obviously COVID has ensured that the waiting lists are even longer. So now it's harder than ever for people to access help from a, in terms of evidence-based treatment, science-based treatment for their tinnitus. So this is so relevant now, and it's so important that we do everything we can to try and raise awareness and try and help people with tinnitus.
Because so many people were just told to live with it, get on with it. That's pretty dismal scenario.
And it's easy to get frustrated with the doctors and the GPs, but the fact of the matter is, it's a systemic problem, because, as I mentioned, I didn't learn anything about tinnitus, or for that matter, much about hearing loss at medical school. I've got friends that are GPs, qualified GPs, and it's not really part of the curriculum. If you look at the published research, there is it has been demonstrated that GPs don't know. Or GPs don't feel comfortable managing tinnitus. They manage it in a number of different ways. And this has been, they've asked surveys to GPs. They've looked at how GPs have managed tinnitus, and there's a huge variety in how that happens. And what that means is it's a very frustrating experience for the patient, for the person, for you guys when you go to see your doctor with tinnitus. So it's about engaging the GPs. And the Royal College of GPs, the people that manage the GPs, and it's about ensuring that everyone has the education that they need in order to best manage this condition. Sort of a statistic: so there's 1 million appointments, GP appointments per year, with tinnitus as the primary complaint. So yeah, it's a big problem, and a lot more needs to be done in raising awareness.
How is it actually diagnosed? Is it an audiologist who does some tests and diagnoses it, or is it a process of elimination of other diagnoses?
Yeah, it's largely it's largely dependent on what's causing the tinnitus. So there's a number of sort of tinnitus causes. We usually split them into reversible and non-reversible. Reversible causes include things like earwax. So earwax can cause tinnitus. An ear infection could cause tinnitus. And then there's rarer things as well. So, I don't want to worry people. In very rare cases, tinnitus can be caused by like a growth in the around the nerve. And if the doctor suspects that is the case, you'll have an MRI scan to rule that out. That's very rare. In the irreversible causes, it's things like noise exposure, associated with hearing loss from old age. So when we get older, hearing loss becomes a lot more common, and it's called presbyacusis is the medical word. But hearing loss associated with this can cause tinnitus as well. So it's normally diagnosed. It's not a disease in itself. So the diagnosis would be, it's a symptom of a disease. So the diagnosis would be, what's the thing that's causing the tinnitus? And in actually a lot of cases, we don't find out. As you say, it's a process of elimination. If you have tinnitus in one side, for example, and you're referred for an MRI scan, and the MRI scans normally say, okay, there's nothing sinister causing this. There's nothing nasty causing this. You have a look in the ear, there's no earwax, there's no infection. Okay, there's none of that things causing this. If someone's, in the older age bracket, then they could be, okay, well, this could, and they have hearing loss as well. And say, okay, well, this could be associated with hearing loss of old age. But if it's someone younger and they don't have any hearing loss, then we don't necessarily 100% know what the cause is.
Okay. Is it normally in one ear, or do you have it in both?
So it varies. It's normally in both. Tinnitus, if anyone has tinnitus in one ear and they haven't seen a doctor, I would strongly advise going to see a doctor soon, because tinnitus in one ear can be symptomatic of something, either something that we can fix or something a bit more serious. So if you have tinnitus in one ear, you'll usually be referred to be a specialist, probably for an MRI scan.
Okay. Are there any medications that help? Nothing will cure?
No. So we know that, so there's been lots of research studies looking into medications helping with tinnitus. If the time when medications can be useful is if tinnitus is having an impact on mental health. So if your tinnitus is causing depression or anxiety or something, then we can prescribe antidepressants to help with the tinnitus. And of course, all these things are linked. So there's a vicious circle that happens here. And if you're treating the sort of the mental health aspect of the problem, you can improve the tinnitus as well.
How sad is that? Actually, my husband's asking a question: is vertigo a cause? His definitely came after he had an acute onset of vertigo, and the tinnitus manifested itself quite quickly after that.
Yeah, so that's really relevant actually. So vertigo is like tinnitus. So vertigo is a disease in itself, but a symptom of a disease. And there are lots of things that can cause vertigo alongside tinnitus. So I mentioned a simple thing like an ear infection. If infection of the outer ear or an infection of the inner ear can cause those two things. In rarer cases, you have something called Meniere's disease,
yes.
which is a condition that many people will have heard of. For those of you that haven't, it's a dysfunction within we call them the hair cells within the ear. And what happens in the inner ear, there's this very small piece of equipment called the cochlea. And the fluid will rotate around the cochlea to determine balance. And when the hairs that recognize that dysfunction, that's when Meniere's disease happens. And that can cause vertigo, hearing loss, but also tinnitus. And lots of people with Meniere's disease have quite debilitating vertigo and tinnitus as well.
My mother actually had it and had a combination of everything, not always, but she did have intermittent vertigo as well. If anybody's got any questions, please, this is your opportunity. Deirdre Doran, my husband has it, and he has Meniere's. And no, actually, let me put this question up here, and we can see it because it's quite sunny here, and I can't. It's hard to see. Oh, we were told not to have too much salt. He had vertigo first, Deirdre.
Hi, Deirdre. Thank you for the comment. I'm very sorry that your husband's had Meniere's disease. It can be quite debilitating. First thing I'll say is I'm not an ENT specialist, but I would say I've not heard about the salt thing, but I certainly think that's something to look up. In terms of there's nothing that can be done, I think that's a little strong. There is things that can be done, and there is things that can be done to manage the individual symptoms. So there's medication that can be taken to manage the vertigo. There's no cure, but like with tinnitus, there's things that can be done to manage it.
Okay. Elaine, this is interesting as well. Another focus on diet and food. Can your diet or fasting help in any way to manage tinnitus in terms of loudness? Yeah,
really? I would say it can, because I mentioned that stress can make tinnitus worse. So we know that the more stressed you are, the louder your tinnitus is, and the louder your brain perceives the tinnitus to be. And so that means that everything you can do to reduce the amount of stress you have will reduce the loudness of the tinnitus. Therefore, and we know from the science that a good diet, a healthy diet, I'm not 100% sure about fasting, but I know there's lots more science and there's lots more evidence coming out that fasting can actually be very beneficial to a healthy lifestyle. So diet can reduce stress, and a good diet can reduce stress alongside exercise, stopping smoking, all that sort of thing as well. Being healthy, as with all these sort of conditions, all these diseases, being healthy, eating well, not drinking not drinking too much or smoking, exercising regularly is always going to be beneficial. I would strongly recommend doing these things. Not just physically, but for there's loads of evidence that demonstrates that mentally as well, for your mental health, these things are beneficial.
Fascinating. Here's a good question. Is there a higher incidence of tinnitus now among younger people listening to music on headphones and loud concerts? I mean, constantly have headphones in our ears. Yeah, so it's you've got an example of one of those people sat in front of you right now. So I think the reason I have tinnitus is because I listened to music too loudly when I was younger. I went to concerts, I went to gigs, I didn't wear hearing protection. There is a very high incidence of tinnitus amongst musicians, DJs, and people in the music industry. And we know that the number of people with tinnitus is going up. So I think it's an 8% increase in the number of people with tinnitus predicted by the British Tinnitus Association over the next decade. So yeah, the number of people with tinnitus is going up. And I think that's due to a large number of factors. Music and listening to music too loudly is one of them. But I suspect an aging population as well. So as people get older, they have hearing loss. They have tinnitus associated with their hearing loss.
that they'll get as a condition of their old age.
And then COVID, the gift that keeps on giving as well. I only realised that a couple of days ago, that there was an association. Another question, I was told, sorry, let's see this. I was told by my doctor that changes in hormone as you get older can bring on tinnitus. Gosh, changes in hormone are blamed for everything.
Yeah, I know, and it's and yeah, that's absolutely true. It can cause tinnitus. I've spoken to 3 or 4 people, 3 or 4 women now that have had tinnitus as a result of the menopause. But as with all these things, if you treat the cause, and the cause is sort of treated effectively, it can improve the symptom of the tinnitus as well. So it can cause those things, and usually we sort of take a combined approach of managing the menopause alongside managing the tinnitus as well. Okay,
very hot topic at the moment. If anybody else has a question, please, this is your chance, your golden opportunity. And for people popping in, somebody had asked a question about what should they do. They obviously didn't realize that you have developed this app. So maybe remind us again where we find it at, Ed, and how they use it.
Sure. So we, as me and my co-founders, have developed a digital solution for tinnitus. So this app is a way for you to access all the treatments that the science has shown to be effective in tinnitus management. And that includes things like CBT, cognitive behavioral therapy, targeted mindfulness, relaxation therapy, and some physical therapy as well to help you relax the jaw and relax the neck. You'll access these therapies in very much the same way you use a meditation app. So 5 to 10 minute recorded audio session each day. It's so simple. You open the app, put your headphones in, press play, and you've got a very pleasant, relaxing voice taking you through a therapy session. It's so simple and easy to use. So the app is called Otto, which is the word comes from otology, which is the medical science.
Very clever, I thought, yes.
Yeah. So OTO. Our website is joinotto.com. So just joinoto.com. If you want to download it from the App Store, you just search Otto Tinnitus in either the Apple App Store or the Google Play Store. We're available for both. The app is available to try completely free. So you can sign up for a free trial for up to a week. Won't pay anything. If you find it beneficial, then that's great. Continue using it. But in the circumstances that you don't find it beneficial, then there's no sort of obligation to pay. We have shown that we did some research recently where we measured the impact of tinnitus on people's lives before using the app. We let people use the app for a month, and then we measured the impact of tinnitus again after a month's time. And we found that 86% of users had a improvement in their loudness, their perceived loudness of their tinnitus. So we have some good preliminary evidence that this app is effective, and the solution that we've provided improves tinnitus and reduces the impact of tinnitus on people's lives. I should say it's been developed by sort of a team of tinnitus experts. So I'm a doctor, my co-founder George is a doctor. We've got Jamil, who is an ENT surgeon, ear, nose and throat surgeon, working at the forefront of sort of hearing and tinnitus research at the University of Cambridge. And the therapy content has been written by a tinnitus and hearing therapist, Anna Pugh, who's a sort of nationally renowned tinnitus therapist who's got decades of experience of looking after people with tinnitus. So, we have an industry-leading team to tackle this problem. And I'd encourage anyone with tinnitus or knows anyone with tinnitus to give it a try. Send us a message. If you have any feedback, please write to us. You can send us a message in app. So, yeah.
That's wonderful. I was going to ask you about your team, so you've answered that for me. Here's a question, but I don't think I understand it. Marion, what is the normal age to get tinnitus? I had a hearing test recently, and because of tinnitus, it was difficult to diagnose. Was that her level of hearing was difficult to diagnose because of the tinnitus?
Yeah, thank you for the question, Marion. I think I know what you mean. So sometimes the tinnitus, because you have the tinnitus, it can actually stop you from hearing the sound of the beep in the hearing test. And that's common with people with tinnitus. That happened to me when I had my hearing. You have to have hearing tests in the military. So that happened to me as well. There is no normal age to get tinnitus. So anyone can be diagnosed. But if it's associated with hearing loss, the onset of that would usually start sort of in the 50s and the 60s. And that's sort of when that's sort of when the number of people with tinnitus starts to increase, the percentage of people with tinnitus in the population starts to increase if it's related to their hearing loss.
It's an interesting one. Is there any evidence that ginkgo?
Yeah, so thank you.
Can help with boosting circulation.
Yeah, ginkgo biloba is a herbal remedy, I believe. I'm afraid to say there's no evidence at all that these have any impact. There've been numerous scientific studies looking at the impact of these, and you can look at these on the British Tinnitus Association website. And they were no more effective than a placebo in improving the impact of tinnitus. You have to be very careful with tinnitus remedies. There's lots of stuff that's sold online that's touted to be effective and stated to be effective. But if you look at the research behind these, there is very little evidence that they are effective. And the British Tinnitus Association has a really useful tool online. If you just search BTA, Tinnitus Treatments, it has a traffic light system. So you can go through all the treatments and you can see, firstly, is it safe? And secondly, is it effective? And it will tell you which treatments are effective. But please, I would urge anyone watching that just please be careful with tinnitus treatments, because people will try and sell you stuff. And, that ranges from just sticking garlic in your ears, just to sort of, the more extreme things like sticking candles in your ears and things like hot candles in your ears. So please be careful with tinnitus treatments. The only effective or the most effective treatment is cognitive behavioral therapy. There has been no tablet or herbal remedy that has been demonstrated to be more effective than a placebo or a sugar tablet. So do be careful with tinnitus treatments.
Okay. There's another question here and I've missed it. Sorry.
No problem.
Hello. How does tinnitus? Sorry, I'm gonna have to put these glasses on again. And you're in Spain. I shouldn't have sunshine in Ireland.
It's Michelle, isn't it? How does tinnitus affect the hearing?
Here we go. That's better.
Yeah, thank you very much for the question, Michelle. So tinnitus is actually something that is a consequence of affected hearing. So it wouldn't be tinnitus affecting the hearing. It would be if something else, another condition is affecting the hearing, it could cause tinnitus. So the tinnitus is as a result of something that is affecting the hearing. So if I give you an example of noise exposure or noise damage. So noise damage, standing next to something very loud for extended periods of time, can cause problems with hearing. And as a consequence of that, you get tinnitus as well. We don't know exactly why that happens, but we think it's due to when you have hearing damage from noise exposure, certain frequencies of the hearing are affected, and we think it's the brain trying to overcompensate for that lost frequency. So you can no longer hear the frequency at the sort of the frequency that you can hear your tinnitus. So your brain creates the sound of the tinnitus to overcompensate for that. We think that's sort of the latest sort of understanding of why that happens. So tinnitus is a consequence of something else.
Okay, this is interesting. Marion, I had tinnitus for a number of years. Once I retired from my very stressful job, thankfully my tinnitus went. I was practically driven crazy with this condition and tried everything at the time.
So Marion, thank you. Yeah, I mean, that's such a clear demonstration of the impact that reducing stress can have on tinnitus. My tinnitus gets so much worse when I'm stressed, and that's very common. That it really does make a big difference. I'm so glad that your tinnitus has improved, and I'm so glad that you've had that experience, because it's a light at the end of the tunnel for people that will show that if you do these things to manage stress in your life, your tinnitus 9 times out of 10 will improve as well.
That's wonderful. Do you know something? We're going to end on that happy note, light at the end of the tunnel, because I think a lot of the girls are saying they're going to get the app and find the app and use the app, and hopefully that, even just in this little session, that you've transformed lives, because it is life transformational if suddenly you can control this. As Marion said, and I know Marion, she's a strong lady, and she said she was practically driven crazy.
Yeah. and we speak to so many people that have had a similar experience. It literally does drive people crazy, and people are, you know, at their lowest when they come to us. So if anyone is watching or listening that wants to use the app, just please do let us know what you think to it. Please do give us some feedback. We're always looking to improve. So if there's something you didn't like, something that didn't work for you, or a problem that you found, just get in touch, and I'd be very happy to speak to anyone that wants to speak. But Anne, it's been so good. Thank you so much for having me. It's been great.
I'm so delighted you stumbled into my path courtesy of Lightbulb. So I'll let you go because I know you're helping your girlfriend's parents move house. So
yeah,
and it's funny. I think my stress levels are going to go through the roof in a minute. I've got an electrician in Dublin ringing me repeatedly all through this call. So God knows what delight he has in front of me. So listen, we'll stay in touch. Everybody, I'll post the links to Otto and the website and everything here so that they have no excuse not to get in touch with you. So that was a delight. Thank you so much. So educational, such a phenomenal topic, and good luck with your moving.
Thank you very much, Anne. Much appreciated.
You're very, very welcome. Okay, so over and out. I'll be back next week. We're going to have a construction theme next week. Gosh, I might even talk about noise pollution in the middle of that. Lots of thanks coming in. So have a good weekend, everybody, and I'll see you back next week. Thanks, Ed.
Thank you.